back to Cranio Family Vlog, where every single day in the month of September we are tackling another question to teach you a little bit more about the world of craniosynostosis. Today we're talking about what is endoscopic surgery.
Now, we have not personally experienced the effects of endoscopic surgery because we opted for a much more invasive CVR procedure. However, this is a recommended procedure for those that qualify for it because it is less invasive. Specifically, if your child is diagnosed under the age of 6 months and you are able to have all the scans and prep needed in order to have the procedure before your baby is 6 months, that's you have a much higher likelihood of having a good endoscopic procedure outcome. More traditionally, this is used just for those affected by a single suture cranio. So if only one fuse has happened within all of the sutures within the skull. However, as the technique has furthered and the craniofacial teams have gained more experience and knowledge in this procedure, they have been able to work with additional sutures as well. So that field is growing, and we are no longer just seeing babies that are affected with single sutures using this procedure.
And speaking of the procedure and the technique, many of you who are watching this have heard of endoscopic procedures before. They're used more often now with knees, ankles, shoulders. Endoscopic surgery is much less invasive. There's less opening of the body, less body cavity being exposed. So that very much follows suit for this kind of surgery. A very similar technique is used. A very small opening or two are made in the scalp of the child, and a lit tube is passed through, and that has a camera attached to it, and then some surgical implementation tools are passed through a second hole. The plastic surgeon will work with the tools that are attached to the mechanical end of the endoscopic surgery implementation set and reopen or manipulate the suture that is affected. If it's closed, if it's partially fused, they will actually reopen it using these tools and then withdraw the tools and the light. They only have to put a few stitches in, and then the child is usually sent home, if not the same day, within just a couple of days for a faster recovery. So they use the tools through the opening to reopen the suture for the child, and then they'll withdraw the tools and they'll stitch up the openings, and the child will recover and go home. This is much more preferred, as Katie was saying, versus the other surgery we have discussed before, because they're not as invasive. Unlike the CVR, where they're taking the skull off and making the hundreds of micro cuts, they're literally just cutting open the suture or along the suture line on the skull of the child, which means that the brain isn't being exposed. There's no worry about the dura tearing. There's a fast recovery. The brain's able to expand by its normal means because the suture is there again. So this procedure is growing rapidly in its use. As Katie said, we were not able to benefit from it, not just because we chose, but because Zoe's situation and condition is a little bit more severe than what is warranted for endoscopic surgery.
And so within a few more minutes, you have learned a little bit more about Cranio, and specifically about the endoscopic procedure and its benefits, and also who can benefit most from it. If you'd like to check out more information, you can find our blog at craniofamilyblog.com. Thanks so much. We'll see you tomorrow.